All right, welcome everyone to the North Carolina Maternal Health Innovation Community of Practice for October. Our session today is listening to our Latina mothers. And our presenters are Emilia Suarez, she's the Health Promotions Coordinator at CityGate Dream Center, and Nkechi Charles, who is our very own at UNC fourth trimester project research lead. So I will go ahead and kick it to them to introduce themselves and get started with this presentation. Please do keep your Q&A in the chat. I'll be monitoring the chat, and we will have time at the end for discussion and to answer some of the questions.
It's gorgeous. Well, hello, everyone. As Suzanne said, my name is Nkechi Charles. I work with the fourth trimester project, and Emilia is with me here. Hey. At the Dream Center. So we're actually conducting this at the Dream Center. It's a great location. We're at their cafe. And so what I want to do is go ahead and share my screen. And there you go. Everyone can see that okay? So the name of our presentation is Listening to Our Latina Mothers.
Escuchando a Nuestras Madres Latinas.
And so know that this presentation will be done in English, but one thing that was really important to us is putting language at the forefront because that's usually what affects our communication. It impacts our ability to access resources. And so one thing that we have learned working together, I learned from a lot working with Dream Center, is the power of listening and what happens when mothers feel heard. And so what I'm going to do is go ahead and frame our conversation, because you'll hear a bit about what the Dream Center does with regards to women and mothers, but also learn what we've heard from stories from the mothers that we had a privilege of engaging with. And so with that, I want us to have a lens of resilience. I know resilience has been a word that's been used a lot, but one particular definition I prefer, it comes from Michael Ungar. He's a social worker. He's a resilience researcher. And the reason why I prefer his definition of resilience is it aligns well with public health, where we recognize that health is not just an outcome based on individual behavior, that one's environment is also critical here too. And so the way Ungar defines resilience is the individual capacity to navigate towards and negotiate for health-sustaining resources and the capacity for her environment to provide these resources in meaningful ways. And so in working with Dream Center, they're an example of a community-based organization that is embedded in the community and actually facilitates the use of different services in-house as well as out in the community. And it's done in a meaningful way, in a way that matters to the Latina community and other community members that come, and also in a way that's actually meaningful for mothers too. So with that, we're going to discuss looking at Dream Center through the lens as a community space, as a community collaborator, and as a community partner as it pertains to the work that we've done together as the fourth trimester project and the Dream Center. The goal has always been and will continue to be to listen to support families, but specifically we'll focus on how they've supported mothers and new parents and what we've learned from them.
Okay, so we have the opportunity to attend at least 800 people, and also this is increased. We have at least 40% mothers that increased too, and we have the opportunity to working in different areas like sport and art and education to the community. But we have a couple of areas we very focus is like to the resource for diaper distribution. We attend at least 235 families. They come in monthly to pick out the diapers. And also we have the wellness. We try to help to the community with the two difference we have to the two nursing coming Tuesday and Thursday to bring sources to the community, like doctor, where they can find a different things they can help better to the kids. And also we have the whole clinic is they come in Thursday, they have a physical therapy for the community.
Now, one thing I want to highlight here, let me make sure. There we go, is what this represents, and coming from a resilience perspective, that these resources are coordinated in that childcare is provided for while mothers are taking those classes, or their children activities are going simultaneously, parallel. And so not only, so it makes it more likely and possible for mothers and new parents to participate in this way. And it comes from, like Emilia said, from the family, from parent support, to resources like the diaper bank, which they were critical in providing that, especially during the pandemic. And the wellness and the clinics for uninsured or those who have spent their allotment for physical therapy, as well as all these different screenings. And so not only are these services coordinated with other activities that can benefit the family, but they're continuous and they're co-located. Co-located is my favorite word because it allows to keep what I call the dyadic unit together, whether it's mom and baby or mom and child or mom and children or parents and children, the whole family. It allows the ability for a whole family, but especially mothers, to be able to streamline where they need to go. Because in the past, we've heard a lot of critiques about not being able to bring their children to appointments or having to figure out who can watch their child while they go to an appointment. And so again, I want you to, those 3 C's, alliteration, coordinated, continuous, and co-located. It allows for one to foster resilience, the ability to navigate and negotiate those resources. And because it's done by the Dream Center, these are programs that the community has actually wanted to participate in, and then being delivered in a meaningful way. Now, Emilia is briefly going to talk about how the Dream Center has served as a community collaborator with and for mothers.
Yes, the mothers all time coming to, they want to learn more about how they can help into to her family or her kids, right? So sometimes they come into me and say they want to know more about how can help into how safe is the school for the kids. They want to talk to the police department, so we have a good connection with the police, and we bring somebody to the police department, the police department, and they talk to the mother. They have many questions about to the school. Also, we have the Women Resource Center in here close to us. We have a very good partnership with that center, is because we have sometimes the domestic violence, domestic, I'm sorry. So we have a good connection with they, and they helping a lot. They give a lot of support. We can find a lot of things with the Women's Center, and they helping a lot to the women.
Yeah. And do you want me to do this one?
Oh, yeah, you can do it.
So one thing that's funny or exciting, that was exciting to be on site here with the community partner while Emilia and I were meeting. So the North Carolina African Service Coalition has an office space that the Dream Center has opened up to them, and they serve refugee families. And so one day while Emilia and I were here in this very room meeting, one of the representatives had come and was connecting with Emilia because there were supplies that were needed for mothers that were coming from refugee camps and being resettled here. And they needed diapers, they needed clothes, they needed other resources. And so it's sort of exciting to see real time what it means to collaborate with different organizations in a meaningful way, specifically mothers and specifically refugee mothers. And it was also an opportunity that Emilia, being the connector that she was, went ahead and introduced me to the representative, and I had an opportunity to share about, the 4th trimester project and efforts being made to improve postpartum care. And he was very open and receptive to leveraging those resources to really help new mothers in this country navigate the healthcare system, but specifically for maternity care and pediatric care for their children. So that was really exciting to see.
Okay, also we have the opportunity to have 2 sessions. We divide into part first and part second. The first part, we have the opportunity to talk to at least 72 mothers. You can see the pictures. We do it in different ways. We do one-to-one. We do a presentation. We go outside and talk to the people about this.
Yes. And so here, what Emilia is describing is how the Dream Center is serving as community partners. So they've been community partners with different universities and different organizations, including the Fourth Trimester Project. And so with these different listening sessions for part 1 was primarily on the website. And in part 2, we had an opportunity to do the El Plan Postparto, the postpartum plan document, just to make sure that though we had translated it, we wanted to make sure, did it resonate? Did they, were Spanish-speaking mothers and parents finding this actually useful? And it was also exciting to also introduce the video reels that real time have been developed and some that were being translated in Spanish. And so you'll notice that the size difference from 72 to 24 is different. That was intentional because we wanted a more intimate environment where there can be more conversation, more time for people to share and about their feedback and be more specific. And so one thing that we did from the first, linking the first set of sessions to the second set of sessions, our position was to listen to learn, right? We didn't want to listen just to see whether our tools were working in the way that they wanted, but we wanted to really learn about the community and also learn how these tools can be leveraged in a meaningful way using that resilience framework. And so as a Fourth Trimester project team member, I was observing the community, and again, the community was very free in their feedback, and were able to highlight what was really meaningful. And a community asset, because again, resilience is more of an asset-based framework, is just the power of the informal social interactions. And I saw that when once Emilia started sharing about a website to 1 or 2 mothers, she started having mothers come to her saying, I want to learn more about it. I want to be able to do this. And also because of the different activities with the kids, and they have like a mini soccer field indoors, Emilia was able to connect with different mothers informally, easily, just to introduce that this is a resource that's available, which I'd like to learn more about it. And so really recognizing that there's ability, especially when it comes to public health, to really amplify and leverage the strengths that already exist in the community. And it's those informal social interactions, those community spaces where one can really effectively engage. And then there was one barrier that we did observe, which was the limited literacy, where Emilia will be maybe in one-on-one sessions. They preferred that as opposed to a group setting. And they would ask her to sort of read out what was being read on the website. And so that's something that we had to sort of think back. We've been very intentional in the design of the website and the materials to have the right tone and to have the right literacy level. But it also exposed like the value of relationship and communication, like women wanted to be heard more, right? And so in the second set of listening sessions, again, we are launching, thanks to Suzanne's amazing work, launching some Spanish language video reels, one that introduced the website, and this one in particular, the Hormonas Postparto, was particularly interesting to watch, because again, as a qualitative researcher, I'm always liking to observe the room, and they're brief videos in Spanish, visual, and in watching the women watch the video, you could see the receptivity, and you can see the shaking of the nodding of heads, and like sort of these little light bulbs, like, oh, that's what's going on. And towards the end of the video, they gave it a round of applause, which I was shocked. I actually texted the whole team saying, we just got a round of applause for this video. And so I was asking in my broken Spanish, what resonated with you? And they say, well, it's just really encouraging. It helps explain what was going on in our bodies. And it would have been very helpful had we known that earlier. But I think one woman really talked about was really at the end, how they really encouraged us as mothers that our care is important, that what's going on with us is important, and that we can be heard. And so that's really exciting, because we see that as an opportunity to sort of address that limited literacy that can occur where there may be individuals that feel more comfortable receiving information in video format, and for both, and it's a very broad kind of approach, because there is also writing at the bottom of the screen, so one can either read
to the diner. First stop is Bale Johnston Community Center.
Hang on, I can.
Okay, so I don't know where that came from, but also for those who feel more comfortable seeing it visually, that was very helpful. And then the Mi Plan Postparto, it was nice to hear that there weren't that many issues with the
when I give
okay.
Yeah, no, and they love it, the Plan Postparto. They all the time say, "Why I know this before?" That helping me a lot. That is a good opportunity. So that is great idea. They love it. They love it that when we talk about, we explain what is this. I say, man, I don't know this before. So they said so.
Yeah. And it was good, and they're different personalities who like shorter forms and longer forms, but all of them agreed that the information was very important and could find it useful. But one thing, again, observing them talking about it, is it was creating a space for mothers to voice their maternal experiences as they all chat about this question or they make a joke. And so just and centered around this one tool, we see this community of mothers. They've been in this space before, but they may have not known each other. And you're seeing this community of mothers being formalized and strengthened and discussing. But in that, creating that space, mothers begin to also talk about one feature of the plan, would share some of their experiences. So Emilia is going to be highlighting 3 of those experiences, and we'll be going back and forth in between.
Yeah. Okay, the first experience and that thoughts or her is when the lady, she said she lost her baby and she don't have anybody here in this country to help him. Her husband all the time is working, so she don't know where she go. She nobody give to the counselor, about what she need go or how helping her. So she's crying. Also, she remember that when we tell her the history, she's crying. She's literally crying how she feeling when that happened.
Yeah. And so it was an emotional moment. It was an unexpected moment, but the fact that she felt safe enough in that space to share that experience and be motivated to share it, just to acknowledge that there may be other mothers also experiencing that. And what prompted her to bring that up was actually we had the postpartum international information that's also available, where there's support groups in English and in Spanish. As from a 4th trimester perspective, do you want to go ahead and read?
No, I think it is.
For the 4th trimester perspective, there are also resources that we have available in the saludmadre.com for them to also use as additional resources.
Cuando hola se convierte en adiós.
So what this is basically when hello becomes goodbye. And so there are resources in how to have those first conversations, or how to even have that language around experiencing infant loss. And so as for those who are clinicians or are engaging in the community, I just wanted to highlight this resources that is available, and also the in the postpartum plan document, it does have information from Postpartum Support International regarding those support groups that are also in Spanish as well.
The other one is language barrier and prevention screen. We have a one lady, she have the baby in Chapel Hill. She living here now. She have the baby in Chapel Hill. When she said to us, when she had the baby, nobody doing anything with her daughter. No checking, they not take it out to do into the screen or checking the baby. The baby stay all time with her. When they did the discharge, after the next day, she had the appointment with the pediatrician, and she started to see something in her daughter's eyes. She come into the doctor, and the doctor said that it's normal. She's just burning. And the next 2 weeks, she started to see something in her daughter's eyes. So when she had the monthly appointment, she did the comments to the doctor, and the doctor said that's normal. She's only 1 month, nothing happened. And the second month, she told to the doctor, please, I need appointment with the for doing the screen to my daughter, and something is in her eyes. Now, after 4 months, they figured out that her daughter had something on her eyes.
Yeah. And so the reason why I want to highlight this and connecting with the first story is more about what it means to have emotional isolation, where you have no words and no one to talk to about something difficult that does impact one in the postpartum period, even those that have had infant loss. This is an example of a language isolation where no mother should have to fight against or push forward over and over again. And this was an instance where a routine screening that should have been done at discharge when the baby was born was not done. And she had expressed that she had assumed that it was done, and it was in her own observations, even though for some reason the doctor's office wasn't receptive to exploring it further. It took a lot longer for her daughter to be diagnosed. I'm not quite sure what the condition is, but she does have to wear special glasses to help address it. But the reason why we put it under the umbrella of postpartum, highlighting that dyadic unit, that the well-being of a child also impacts the well-being of the mother and vice versa. And especially in the postpartum period, as a first-time new parent, you're not being able to protect your child can also have an emotional challenge, emotionally, and just the level of confidence one can have in becoming a mother. And so, and that way, just really thinking about how this was meant to highlight how language barriers, number one, do occur, and that even when one is trying their best to communicate what their needs are, they're not being heard. And so we hope to find ways in which that could be changed, like having a checklist of what is exactly is meant to be done during discharge, and is very clearly available in Spanish for parents to sort of track, okay, these things have been done. One thing we do have, and on the 4th trimester website, is an information sheet for babies. And now, though this particular condition is not listed here, what this does do is, number one, let mothers know what are the key things that that they should be concerned and when they should call the doctor. But the act of even providing this one-sheeter is empowering mothers and reminding them that they do have the right to call the doctor and be heard about the concerns of their child. And so this is speaking to how we might deliver these resources, not just hand them a sheet, but also have that conversation that there may be different things that come up with your child. These are the key things we want you to look for, but there's something that's not on this list that's of concern. You can call us and we can assess whether or not additional steps are needed.
And the last one, this child, we know where to go. That lady is coming here from the other country, and she's coming alone. She's coming pregnant after having 3 days in the hospital. She don't know where she can go, or that they said they need living. That's the normal, right? But she don't know where she go. She's outside with her baby. she not receive any resources
Mm-hmm.
or nothing, and she feeling so lost in this country.
Yeah. And so this is the one that all these experiences affected me, but this one affected me the most because this is an account of an experience, an immigrant experience, where she did come alone and she did not know the language and she did not know where to go. And I remember her clearly saying, again, the reason why I'm saying this is because I don't think any mother, no matter where they're from or no matter what language they speak, should ever have to feel that lost, especially with a new baby. And it was very hard. And in the 4th Trimester project, we really advocate for creating a community. And we've had in the past, people are like, we're so excited to find a village. And the challenge for us at the 4th Trimester project is that because this website is viewed locally, nationally, and also internationally, it's impossible for us to have an existing list of where these villages are. But what I've learned through working with Dream Center just reiterated that community-based organizations are the perfect places that are strategically located to allow for those villages to form. And they have our resources available. And so the idea has been like, how can we activate the village, right? And there are different ways to do so. One way is like with the 4th Trimester project, we have all these materials that are for free that can be printed out. And Emilia and I were just discussing this. Do you want to say what the idea that you came up with?
Oh yes, I tell her about to have something, create something here to the people can come in, we can download, we can print her to the papers, and we can help them, and they can find here a place where they feeling safe, happy, and they can find the information.
Yes. And remember those 3 C's that I said? My favorite one was the co-location. Like we also discussed the possibility of while kids are playing indoor soccer, because she's often seeing pregnant mothers just watching their kids or just waiting for their kids to be done. This cafe is right next door. And so the idea of creating that village, it can be a very simple format of a small group setup where one topic can be discussed looking at one of the resources and they just talk about it, right? But the whole idea is actually to strengthen the village. Strengthen the village while informing them of valuable information that can help them during their pregnancy as well as during the postpartum period, to make sure that they have what they need. And the fact that the Dream Center also has these other resources with the nurses' visits and the physical therapy, it allows an opportunity for them to also connect them to other resources that are available. And so I go back to the first slide that I had when I talked about resilience. And our invitation to you guys is just to think in what ways might you partner with community-based organizations to help support mothers in your community, right? And it doesn't have to be super complicated. It can be as simple, but also strategic as having an existing list of community resources in your area. And the one thing that I would ask is to make sure that it's reviewed at least twice a year just to make sure it's updated. But once you have that list created, it's just a matter of updating and making sure it's up to date and being able to provide that. But if you're willing to also continue to take advantage of collaborating with community-based organizations, you can create an opportunity to engage with the group of mothers in your area and ask them, what are your experiences in receiving maternal care and postpartum care, and how can we be more effective? How can we help you? What is needed? What is necessary? To make you feel that you can be confident as you are entering this phase of your motherhood. And so with that said, we are done. I mean, we talked a lot and really fast. But we just wanted to make it open to any questions or any conversations. Suzanne, I'm not sure how much time we have, but even if it's not about what we shared, but just some challenges you're having in regards to knowing how best to serve this population or any other specific population group.
Thank you so much. I'm going to go ahead, and if you want to stop sharing, we can go ahead and have the discussion. Let's start off. Is there any questions? Does anyone have any questions about the presentation? Emilia and Nkechi, it was so wonderful. And I do appreciate the time and the photos. Those are my favorite to see. Go ahead, Sarah.
I always have questions. So I have two. One is easy and one is maybe less easy. The first one is I'm wondering again how long CityGate Dream Center has been there. And the second question is, you know, what do you when say a clinic or an organization wants to partner with you, what can they do to be a good partner, or what do you want in a partner?
This is a good question. Well, the first one, remember the first one, please?
It's how long is CityGate?
Okay, how long is at least? I have 3 years working in the Dream Center, but I here is at least 8 years.
8 years.
I think it started in 2015. That's the day. And the other question is how?
Like, what would be your dream community partner? Like, what would be helpful in the community?
Helpful. Okay, you know, we have a lot of community, especially to the mothers, is pregnant. You know, let me doing a little resume about we have a lot of mothers. They come in here because they bring the kids to play soccer, right? They pregnant, they want information. They know we have the diaper distribution. We have sometimes we have a meal of food for the kid today. But the good part is teach to the mother how they can do it better. You know, our culture is different to here. So how they can do in the follow with the doctors, how doing to the papers, how doing to the medicine, everything. Because it's totally different. You know, all culture is different, all countries is different. And when they came here, they need learn how it's doing here, how talk to the doctor, how have better communication and learn more.
Yeah. So what I'm hearing you say is, number one, one thing that's very helpful is information in those classes, because there's a pediatrician that comes.
Yes.
That's very popular, who comes and
let me show something. Yes. And the pediatrician, sorry for interrupt. They go to the doctor normally. That day, I did a meeting with the pediatrician. I said, the doctor speaks Spanish. Oh my God. I expect having 10 mothers. I have a 25. And they come in and say, and they look like, doctor, I want to ask this in Spanish. I want to ask this. I want to this. They say, you know, something like this.
And so not only is having that language barrier taken away, but there's a desire of relationship. Like we just got the community likes relationships. So anyone who wants to partner with CityGate or in partnering with any community-based organizations, is take that time to build those relationships, because that's where you build trust. And that's where in that trusted relationship, you're actually able to hear what is needed and what would best help support them.
I have a question along those lines. Have you done a needs assessment? And if so, what are the needs that were identified?
So have you ever done? So are you talking about the population amongst the mothers?
I was thinking specifically about the Dream Center, but the population of the mothers would also be really interesting.
So have y'all ever, like, how do you identify the needs, the areas of support that are needed amongst the community here at the Dream Center? Do you do a formal needs assessment, or or is it just through relationship and they let you know what is going on? And
let me see if you understand the question first, because I don't want to answer something else wrong. We talked about the you say assignment? Assessment.
Yes.
Okay. How? Okay, the community I want to just understand the question. Okay, so
That's fine.
if you answer, the community coming here, right? They coming with too many questions. They want to know. They coming here because they found the people talk to Spanish, and they want to redirect. We have a nurse, we have a doctor coming to helping. That's the answer the question.
Yeah, it's a way. And I could.
Okay, so they come in here, and we can fund it. Searches or look how we can help the mothers.
Yeah,
something like that.
So basically, what I'm hearing from her, there's not a formal needs assessment that I'm thinking what you're thinking of, but what they do is they because they are known to be really well situated, like the refugee organization. He's like, the reason why we're here because everyone knows in Elements County, Dream Center is where to go because they're really well resourced. So they're quick to understand what the needs are. And then from there, either they leverage the connections they already have or work with them to find where they should go. But I don't believe there's a formal resource assessment.
Thank you. I was just curious about, the how to be a best partner. And then I'm thinking, maybe matching the needs with thank you so much. This is really helpful.
One thing I remember that was very interesting was, I think it was in relation to Medicaid. I don't know, remember after during our eating time, during our focus group break, where mother couldn't, do you remember and you said, no, you need to talk to this person about Medicaid because they'll be able to get your resources.
They come in and give information to us to give to the people. So this is, I know now how we can redirect to the people.
Yeah. And so a lot of times sometimes there's some misinformation or they're being told, no, you can't do this. And I've heard Emilia say, no, yes, you can. This is who you need to talk to. This is where you need to go. Because sometimes you go there and they say, no, they can't. It's like, do not listen. But all of this is done through relationship. But for those who are interested in partnering, I think that's something that you and Lisa can discuss. But like what services you can provide, and then ask, are those services even needed? Or would that be a help? Because I'm not a proponent of build it, therefore they come. I'm more of an on-demand kind of to build what is actually needed. And some of the programs they have come out of people dreaming about, hey, we need this. And so Dream Center has made it possible to provide that.
What I'm hearing you say also for Liz's question is, and what we found is that having resources for food is important because sharing food and meals builds community.
Yes.
And I'm also hearing that bringing information or calling CityGate or other groups in your communities and say, what do you have to bring, right? We have someone who speaks Spanish who's a nurse that could come and have a conversation circle. Some of it is like thinking about what do we have to give and offering that, and then they can decide if that is a fit, is something that I'm hearing. And with Fourth Trimester Project, we were so lucky that even though we went with an ask, it turned out that there was community, and from that ask, it built community. What other questions are out there? You all are quiet today.
Another question of this, sort of along the lines of the community, and the community as, being such a great instrument for healing. I mean, I know from the prenatal side of things, these centering pregnancy groups have been really effective in trying to reduce preterm birth rate for Black birthing women. And it sounds like there's similar groups happening at the Dream Center. And I'm just curious if you're seeing any changes in, the health of the mom and the baby as a result of these groups.
So officially the groups have not yet started. But one thing I can speak to is that's one thing we discovered with our with a lot of the fourth trimester tools, that using it in conversation is more powerful than just giving the sheet. That's one thing that was, because it just depends on culture, right? If some people just give me my sheet, let me download, I'll do it on my own. But like having a conversation about it And so we talked about how like that centering pregnancy approach, but for the postpartum period, could also be effective as well.
And especially, you know, I insisted, it's different. We are Latinos, but we talk to different, right? So sometimes when they come in here to say, what is this? So we have at the time, and that helps to have a conversation, you know, they understand much better. So yeah, yes,
yeah,
Latino.
Yeah, but that's the whole idea about the village kind of concept, is that almost that centering pregnancy, but you're centering, you know, is like the postpartum period, like, can you get a cohort of women? But one thing that Emilia challenged me on, which was great, was initially I thought, okay, we're only going to focus to first-time mothers, new mothers, but she's like, but there's something powerful about getting experienced mothers and new mothers together, because sometimes they can share information that could be supportive, like we've been there, this is how I navigated, but also for the experienced mothers, there are things that they didn't know. They're like, oh, like I had one woman who had severe preeclampsia, and there was something that we were talking about, the hemorrhaging and stuff like that. And we talked about all the different experiences. Like, I wish I would have known some of these things beforehand, because it would have made sense of what I went through. And now I'm going through the second child. I had it again. And so you see that there's that need for that postpartum community.
Yeah, because you don't know what you don't know. And it's like these privileged groups know because they're in those conversations, and it's, yeah, this is really great.
That's exactly, I'm so glad you said that, because yes, that's the thing that we've always had a challenge even developing the 4-trimester project. Like when I joined, I was just amazed by the team. Like, where do you begin? And the thing is, you don't know what you don't know. And so the beauty of having, you know, villages together is you're just choosing a topic. Like you can have a priority, but sometimes just having a topic, you know, and you may move on to other things that don't pertain to what the 4-trimester has, but just life in general. But like, that's how you discover what you know. Just in relationship and community, in conversations that we have with our friends, like, oh, I didn't know that. That's great to know, right? And so that's one way to address that particular challenge.
I'm curious what you noticed or what you heard from moms about, so I know you kind of talked about literacy and some digital type of, you know, kind of barriers, things like that. But I'm just curious, so if you don't have yet, say, you know, you're saying like getting experienced mothers and new moms and providers and all sorts of people together is really great. I'm just thinking even through my own experience of being new to each journey of parenting, like I'm new to a newborn and then a toddler, and now the challenges of, you know, like elementary school and eventually high school. I'm wondering where moms have said that they are finding resources or like parenting type strategies. If it's like, I have a therapist that's on Instagram, or you know, I follow the 4th trimester for the newborn stuff. If you've heard kind of where their trusted sources are for information related to maybe recovery or maybe parenting or community, you know, things that are around them.
So one thing I do know that you have is the parent support group, the new parent support group.
Mm-hmm.
Do you want to describe that?
We start to the parents support group in the community, because they come, you know, it's like the Dream Center, they want to fund everything, but we don't have everything. We discovered the thing, so we try to create a support for the parents in all areas. And also we create, because they don't know English, so we create English class, computer class to give to support to the people. One thing I found is when we try to do it online to the 4th trimester, is they no can do it in the computer. They don't know. So now that great idea, somebody donate a computer. So we found that somebody give the teaching to the class. So we try all the time to improve to the community, figure out what is the situation they have, and we try to resolve to they can grown up better, I think, you know that.
And one thing, again, being the nerd and researcher I am, because I couldn't get out of my mind about this video reels. I'm like, why is it successful? And the usage of mobile phones is becoming standardized in so many different ways, especially smartphones. And so it was an older study in 2013 just showing how much those Latina community is leveraging phones and communication tools like that. And so that sometimes it's like an easier tool. And so we asked, do you use Facebook? It's like, yeah, we use Facebook, and some use Instagram. But I think at the end of the day, I think power comes in relationship and community and actual relationships. And so the more the word of mouth, the old school word of mouth is a powerful way to connect people where they need to go, who to connect with. And as we found with the fourth trimester website.
This has been great, and I so appreciate Emilia. I think we have in the chat. Is there an email? I know you had it on the screen. If you wouldn't mind putting it, maybe Nkechi, pasting it into the chat about ways to connect with you after this.
Yes.
And I so appreciate our speakers for the day. This was so wonderful. Are there any following questions? I can check the chat. Oh, Kristen, go ahead.
I just wanted to thank you both and affirm how beautiful it is to hear about, well, to see and to hear about connection. And we've talked about, you know, that word in different ways. And I think, you know, proactive resource provision being there as an ongoing source of support for wellness and being really transparent about everything. That's very admirable, and what a model to grow. So thank you.
And I mean, I've enjoyed working here, as Sarah's put in the chat. My kids know the Dream Center now. During our focus groups, my kids will join the childcare, and my daughter's like, "Mommy, I'm the only one. We're the only ones that don't speak Spanish." I was like, "It's like, well, it's a great way to learn about how some other kids your age may feel when they're in the other setting when they don't yet learn, English." And she's like, "Okay," but yes, they loved it. They loved the food, of course, and so they had a great time here. Wow. Yeah. So, but I'm grateful. This is the first time I've seen. For me, it was as one who is a researcher that looks at theory and models all the time, especially when it comes to resilience. It's fun to see an organization that's actually doing it. Like, you see what it looks like to help people navigate and negotiate for those resources, and what it looks like to provide it in a meaningful way that's culturally relevant. And so it's been a privilege to work with them.
Well, we want to just offer a huge fourth trimester team thank you. You and to all the amazing women that have informed the work that now we get to use with patients and new mamas across the state. You matter. You mean so much to us. We're so grateful. We value.
Don't jump off just yet, y'all. I have so as we're planning future communities of practice, I do have a survey. I'm going to go ahead and share my screen. If everyone could pull out their phones. This is a really important survey. It's going to help us to think through topics and speakers, whether it be for a community of practice or a different type of webinar. It could even become, I think there's a question about different types of formats. For example, we do these video reels that they were speaking about, where it's 90-second, short videos about important postpartum recovery topics. And we want to know from y'all and your experience and in your networks, what topics you'd like covered, what's a priority we should be focusing on. We have some suggested topics you'll see in the survey, but please do fill in. There's a text box where you can fill in other ideas or other people you'd love to hear from. So I would like to just pause and let everyone scan this QR code, or in the chat is the link. This should only take a minute or two, but it would be really helpful to inform some of our work and beyond. I'm just kind of looking to make sure everyone was able to scan it before I move on.
I have a feeling everyone's going to want CityGate Dream Center to come back.
Yeah, for sure. We know we've done a great community of practice when at the end they ask for a part 2. We had a fatherhood one last time and they're like, can we do a part 2? And again, can CityGate come do a part 2?
I invite everybody, if they want to know more about the Dream Center, you are so welcome to come in. You are welcome to know what's going on here. It's a lot of people need help. And you really enjoy if you come in here. You can see a lot of things here. Yeah.
Well, while you're filling out that survey, I'm just going to mention that our next community of practice is Tuesday, November 28th, and this time it's at 5:30. Sarah, I'm sure you have more details about this. It's Caden Coleman is doing a presentation in partnership with MHLAC, and it's a live streamed event.
Sure. This is with the Maternal Health Learning and Innovation Center. Caden Coleman is a trans man who has done grand rounds several times at UNC Family Medicine, and he talks about how to provide inclusive care for birthing people, both trans and non-binary folks. He's excellent. He presented last year, and it ended up being a little last minute. This year we have a little bit more lead time. And so I would welcome you to join us. We know it's at an unusual time, but I can promise you he is fabulous and it will be worth it. We are not able to record that. So if you want to watch, you can listen in. Listen in while you're cooking dinner. We will send the RSVP soon. But we just wanted to get that on your calendars because that's an unusual time and it's so worth it.
Coming soon. I just wanted to share that we have these really cool icons our team has created, and we're going to be creating some patient journey education flows. We also have water bottle stickers, flyers, and postcards. So if any of the North Carolina teams are interested in anything, we do have some fun items coming soon. These are always recorded. We have so many great sessions, and it's actually been fun to report how many views after the communities of practice that our YouTube recordings get. So just a reminder that those are there if you've missed one or if you want to share one on a particular topic. And with that, I think we've done it all. I'm going to go ahead and put the evaluation link in the chat one more time. This is just to evaluate today's session. And thank you everyone that did submit the survey for future communities of practice topics. I'm really excited to look through those and hopefully get some fresh ideas.
Yes, and I hope everyone can go out there and enjoy your favorite Halloween candy. If you eat it on Halloween, there's no calories. I have this as a good source of science. So take care, everyone. We appreciate you. And again, thank you so much to our amazing partners at the CityGate Dream Center. You're the best.
Oh, I love that. All right, take care, everyone.
Thank you. Bye.